Good afternoon, senior service providers. We appreciate you making the time to join us today on what it looks like the storm is starting to kick off. So apparently the monsoon is coming. I am pleased to be with you, my colleagues today, and we are joined by Heather Sederma. She's with Contra Costa Health Services, and she's going to talk to us about the sort of vaccine rollout, what we can expect for first and foremost the folks we provide services to, as well as the staff members that we work with as well, and how we all fit into this vaccine network and how we work together. So this is going to be an interactive session, so I want to encourage you to drop your questions in either the Q&A or the chat. We will get to them towards the end. First, we're going to have a PowerPoint from Heather. And again, I want to remind everyone, we're a mixed group today. We've got for-profit and nonprofit, but we all serve seniors. So with that, Heather, I want to thank you for making the time to meet with us today. And I look forward to learning from you. So I'm going to pass it over to you.
Hi there. Thank you very much, Nicole. And I don't know all of you, but I have to say, Nicole, what an advocate you have there. Thank you very much. I want to tell you a little bit about myself. So I am a nurse practitioner, and I've worked with Contra Costa Health Services for about 20 years. My pre-COVID work was with healthcare for the homeless. I've worked in oncology, as well as women's health and pediatrics. Been doing a lot of things with that as a nurse practitioner and a patient, a provider for patients. During the COVID response, I was pulled in with Dr. Levin. A lot of you might know it. She and I have sort of been a witness and soldiers on the front line as this effort has built up. She and I, she's done a lot of advocating for you. And in the very beginning, we were there when we were just in the 1s and 2s and 10s and 20s of COVID cases and the testing and who gets the testing. And then it became the case investigation and how do we get into the nursing homes and how do we support when there's outbreaks. And then now with the vaccination effort and how do we build trust and get the vaccinations out there to the people that need them the most and to everybody. So that's, I've been a witness and I've been very honored to be able to work with this effort because absolutely everybody, I'm a soldier, but all of us are soldiers and we're all ambassadors for good information. So I want to be able to provide you good information that you can take home and share with your family, your neighbors, with yourself, right? To understand a little bit more about where we're at and where we're going. So we're going to go to just a shot of what's going on right now in Contra Costa County with COVID, vaccines, what we have, allocations, how we decide who gets them, how do they work. I think you know that already. You probably had presentations, but again, there's always all of this information. It never hurts to hear it twice. Logistics and the supply and the demand and the reasons why it's not all out there immediately to everybody all at once because there's not enough. So we'll talk about that. And then where to get good information, links, and how you are able to be a self-advocate and an advocate for others, because the more you know, the more you're able to share and get the information out. And then there's always a pitch for prevention, right? We're going to be wearing masks, washing our hands, and really it's the common sense that we've had all along. So we can't forget about that. The big picture right now, over the arc of this, we've gone up and down as far as what they call surges, and then we've been sort of in the valleys for a moment. We were in what we call the orange tier, where we were able to go out a little bit more. Restaurants were opening up. Then that closed down just after Thanksgiving, and the whole state went into a shelter in place. Yesterday, the statewide regional stay-at-home order was lifted, and that means that restaurants are open for outdoor dining, hair salons, lots of reopening, but we still have lots of cases. So this is a dashboard that you can find on our website, and I'll just share the one thing that people look at, and it tells us how we're doing. If you'll see right there, it says county metrics, 60.4 new COVID-19 cases per 100,000. Residents. We want that below 7. We want it 0, but we want it below 7. So this dashboard might get updated tomorrow, but we want that number, and that's the number we watch to really give us an idea how we're doing. And this positivity rate, that 10.8, that gives you an idea of, for the number of tests that we do, that's the percent that come back positive. That's still way too high. We'd like that down around 2, and of course we'd like it at 0. So those are some of the numbers that we look at if you want that big global picture of how we're doing. And this gives you an idea of COVID-19, because people wonder, like, where are we at? There's 1 million plus residents of Contra Costa County. So far, we've conducted almost 1 million tests. We've had 55,000 positive cases. We've had only, but it doesn't mean only if it's your family member, 489 deaths in our county. Most of those have been people over the age of 60. I think greater than 80% have been over the age of 60. And that's how we, even in our own county, we recognize that the older you are, the more vulnerable you are. And then to date, allocated, so that's vaccines that the state of California says, okay, this is the number of vaccines so far that have been allocated to us. Every week we get more. We get about 15,000 more doses allocated to our county. And that's why there is not just broadly all over the place. We don't have 1 million vaccines allocated yet. So we have to be mindful and thoughtful about who we give it to in these early phases. And the number of people, the number of vaccines that have gone in, 89,000. That's pretty exciting, 89,000. I mean, I think it's exciting. And this is a
Heather,
dashboard.
before we go on, can you
Yes,
explain to folks, you had a great little note on that last slide, which says, does not include Sutter, Kaiser, and the VA. Can you tell people why that is? I think that's the question that's so confusing to all of us.
So the vaccine is, so Contra Costa County just serves Contra Costa County residents. And Sutter, Kaiser, and the VA, they are cross-county entities. So Kaiser is over in Alameda and Richmond, and so they are this health system, and the state said, okay, we trust you to vaccinate your members. Here is your number of doses that you get. The same for the VA. That's a federally qualified, so their people can be all over. So the VA said, you get the federal government said, you get your allotment, and Sutter's the same way. So they all are out of the county, but Contra Costa County, we need to worry about the people that we think are are served by us and our public health department. And then I'll go on to, in another slide, the partners that we're trying to do that with. Does that make sense? You think that? And when we go back into partners, as we go further in here, we'll talk about that a little bit more. And I'll just give you an insight. Kaiser for Walnut Creek and Antioch, their doses, the allocation that they get per week, they said it's under 2,000, right? Because their membership and everything. Sutter, I have no insight, and the VA, right? They're all over the place. So they send people anywhere in the region.
Thank you so much. I appreciate that.
Yeah. Go ahead, stop. And this is for you so that you are everybody. So you're more informed than confused. And I like this dashboard, and I just put this one in because this just sort of gives us the graphics. So look at here, we're slowly ramping up in the number of vaccinations that we're giving. And we're slowly stepping down the number of COVID cases. This is post-surge, but I think this is I wanted this image to be imprinted for you. So you see, we're going to just keep going up on vaccinations. And the more we continue best practices and the more we vaccinate, hopefully these COVID cases and this little stair steps are going to stay low, not go back high again. I really do feel like yesterday that we maybe turned a corner when that order was lifted. Some of the things that we know, and this is kind of making our sell. I hope everybody's interested in having the vaccine, but I hope everybody, if not, they're partners in prevention. We know that COVID-19 infections may cause serious symptoms or none at all. So that's one of those things. It could be obvious or it could be silent. So that's why it's scary. That's why the masks. That's why prevention. We're unable to predict how the virus will affect each other, and this is another sell for vaccines. So if you say that you're a person that never gets sick, we don't care, right? We don't know, you might be that one person. It's a bit of Russian roulette. So we want everybody to get vaccinated because we just don't know who you are. And if you might be that young person that gets sick, or that older person that's hardy as can be and gets it and just keeps on going, we just don't know. We know that people older than 65 and people with some medical conditions have a greater risk of getting very sick. And here's that statistic: are older and are more vulnerable. We know over 85% of the deaths in Contra Costa County, those 489, were people older than 60 years old. And the most effective way to prevent infection has been through prevention. So far, mass distancing, hand washing, and now we have the vaccine. All of those are together. These are all our tools, and good education and advocacy. These are the ways that we're going to stop the spread. The vaccines save lives. In the history of the world, I'll tell you, vaccines have been the one scientific advancement that has saved more lives than any other. Think about the measles, think about the measles, mumps, smallpox, all of these illnesses that with vaccines, they have saved lives. The vaccine that we have out right now is the messenger. It's on the vehicle that takes it in and carries it into our bodies is called messenger RNA. And what we've done, that's old technology, 10-year-old technology that we know about. We've done it for other treatments and therapies. And what the scientists, they had this brilliant idea: let's attach a little spike protein, the little COVID into there, because it gets into the body. It delivers that spike protein, so your body recognizes an intruder or an invader. And then the messenger RNA, the vehicle, that disappears and leaves that spike protein, not the illness, but the spike protein in there for your body to react to and build antibodies to. So that's the current ones that are out. The next set that come out, we think they'll be attached to a cold virus. And that cold virus is something our body will recognize. We might have some symptoms from it, but it will also be something that won't harm us. And it will deliver that little COVID spike in there, and it's on a more stable vehicle. So it might be easier to get out there and mobilize and get more people vaccinated sooner. The most common side effects, because again, we want people, the day of the vaccination, we want you to know that you can expect to be observed for 15 minutes after your shot, because some people, very few people have had allergic reactions, but we know that can happen with the day of the shot. So we want to be mindful of that. Day of or after the vaccination, we want you to know to expect a pain, perhaps at the injection site. I got it. I did have a sore arm the first time. The second time I got it, it's like, ugh, my arm is heavy, but happy to have that. Other people have some fatigue, headache. You might have fever or chilling the day or 2 days afterwards, chills, but these are side effects. They're not a sign that you have COVID-19. They're a sign that your body is making antibodies to fight off the COVID. So you do not get COVID-19 from a vaccine. How we decide who gets it, we want everybody to have it. But if we go back to looking at those other slides, we know that there's not enough to go around right away for everybody. And so there's an ethical and equitable allocations committee that decides what to do and how to roll this out. There is guidance and recommendations that we really have to stick to, that the state is imposing, saying, listen, we want you to prioritize the older, the more vulnerable. Do that, right? And then the frontline worker, these are the people, maybe they're young and hardy, but they're the people that are in there and frontline that we need to make sure that we protect, because we need people to take care of our older, more vulnerable when they're hospitalized. And so this is what we're looking at right now. And this is on the website, and I'm going to go on another page to the website so that you can perhaps see, but this is the vaccine eligibility as we see it today. At tier 1, and I think to date, if not everybody in the RCFs and the long-term care facilities has been vaccinated or will be vaccinated by February 7th. And again, a huge hats off to Sarah Levin and her team, and to a lot of you, the aging and the Debbie Toth adults, and our Cal Fire and the partners, CVS and Walgreens, who've been getting out there and getting these vaccines out. The goal is for the 1.1 million residents of Contra Costa County. We're saying we want 1 million vaccinations. So 1 million vaccinations by July 4th, 2021 in our county. That means at least 500,000 people should be vaccinated. And if we get to these single dose vaccines, we think it could be much higher, 600, 700,000, if the next two, AstraZeneca and Johnson & Johnson, truly are one-dose vaccines. So that will be pretty exciting. And the goal to getting more vaccines out to more people is to make access easier. And the access is a little bit harder now, and it's taken more time because there's this thing called cold chain storage. And it's these, the Moderna and the Pfizer, they need super deep freeze. They're not stable for very long. So we need to get the vaccine out. We need to transport it in special coolers, and we need to give it within a certain amount of time. So that's part of the logistics that have made it more difficult, but it's been getting done. And that's just been just a feat and something to respect and admire, I think. This is a map that I wanted to show you just about where the pockets. This is actually dated information, but it's still pretty reliable. As when we're talking about equitability and access, gives us an idea of all the places that we see most of the COVID cases, and they're in denser populated urban areas where there's multiple families living together, shared or congregate living facilities. And so that's what it looks like. And when we talk about access and equitability, they're going to decide, and there's some max vax sites, what we call, and we've got two set up over in the San Pablo region. We've got another in the East County region. We've got one that's one and another one going up in Central County as well. So this is when we talk about access to getting for the people that are not in long-term care facilities, where you might go to get yours. The partnerships to vaccinate and get it out. Again, I spoke about the allocations committee, right? They meet weekly, and I think Nicole Howell is on this committee, and they think about it every week, right? Who should get it? When should you get it? And it is nothing is ever black and white. It's never just one size fits all for everything. Of course, we think our older people are more vulnerable, but there was an outbreak in the detention center. And so even though there were a lot of young and hardy people, there's a lot of people that were vulnerable. And so there was a decision to take some of the allocation that we had and give it to some of the people in detention, because we thought that would prevent more hospitalizations, because we also want to, when older, more fragile people get sick, we wanted there to be hospital beds to take care of them. And so this was one of those ethical and equitable decisions that was made. And it's not easy to be on those committees. The partnerships that we have, Lifelong, La Clinica, Kaiser, Sutter, Delta, we'll talk about that a little bit further, but these are the people that have helped us get the vaccines out to our community. Safeway, Rite Aid are also partnering. You cannot direct make an appointment to them. Those appointments come through Contra Costa Health Services still, and how we allocate them. The max vax sites I discussed, and just right now, again, it's about 15,000 vaccines plus or minus are coming in each week. And with those, we allocate them to Lifelong, La Clinica, John Muir Health, CCHP, and to the people that are taking them out to the RCFs, and to make sure that our frontline healthcare workers and the people taking care of older adults, right? And the vulnerable populations, make sure they're getting their vaccines as well. This is, let's see if this works. I do this okay. I hope this works. So this is our partnerships. This is a COVID vaccine page, and I want everybody to know how to get to this page, because everybody here on this call, we want to be an ambassador for good information and where to get good information. The information that we had on Friday was different than the information that we had on Saturday, Sunday, and even Monday. Yesterday, we were updating information. So I can give you this information, and while most of it's going to be up to date, it might change. And so we'd want to drive everybody to this vaccination page and to our CC Health Coronavirus, page, so that you can keep yourself up to date. You can click on here, and it can tell you about the distribution phases. Here, I'm going to go here, and I'm taking us to the live link, and you can get information about vaccines, how to get tested, health services, resources, partners. This takes you to this page. So if you are a John Muir Health member, this will tell you how and what information you can get from, and who John Muir is prioritizing at this time. The Kaiser, La Clinicas, Lifelong, Sutter, and Kaiser is reaching out to their people, their members. John Muir is reaching out to their members. La Clinica, Lifelong, and Sutter. Everybody's reaching out. But for some of these health systems, so John Muir, Kaiser, Sutter, if you have a portal and MyChart, you're able to go onto those websites and query about whether or not you can get a vaccine, and they will put you, or they will also may send out pushes to you. And so I think a recommendation as far as advocacy and being a good ambassador, make sure that you, your mom, your neighbor, your sister has the information for your health home up to date. Make sure that your cell phone number is up to date and accurate, and that you receive texts. Make sure that your email address that they might get to you is up to date and accurate, because they want to reach out to you as well. Okay, so let's see. I want to go back to this other page. And so this is where we're going with that. So this is how to stay up to date and current. Some of the questions and answers that were put out there, and I'm preemptively giving some of the information that you want. Age 75 up in the general population are prioritized at this time. There are no drop-ins allowed in our vaccination sites. Some pre-existing conditions will be prioritized. Reach out when you fill out an interest form. So if you go to the website on our webpage and you fill out a form, they'll ask you some questions, and they'll sort you and they'll prioritize you. You might not be in the priority group, but they'll know when you are. The same for your John Muir Health, Sutter, Kaiser, La Clinic, Lifelong. Vaccines are free for all, so you should not be paying for that, but they will ask you for your insurance information, because if they are able to bill your insurance company for the administration cost, that offsets it, and ultimately it makes vaccines available for more people and the system to stay afloat. We have a call center for Contra Costa Health Services. It's busy, right? Lots of people have lots of calls. I think there's been thousands of phone calls, and there's been tens of thousands of submissions for vaccine requests, and they're humans. There's people doing this and manning it. And so not only has it been the vaccine that's been, there's been scarcity, but it's been redeploying and moving people in to do these jobs, to answer the phones, to respond to emails. Some of it's automated, but a lot of it takes people. And so we have to understand, and you don't have to understand, but we ask that you understand that these are people trying to do their best. And we've built up a system that we didn't even know needed to exist a year ago. I've said that about healthcare providers. Make sure your information is current. Currently, most people, they're scheduling at the time of when you get your first vaccine, they'll schedule you for the appointment, or they'll tell you how to specifically schedule for the second appointment for your second vaccine. There's no bad batches. There was Moderna a lot down in Southern California. They had some, it was a lot that went out to the whole state, but there was a few more allergic reactions than they expected. It was a total of 10. And so they said, wait a minute, stop. We want to make sure that this is okay. And that's how closely they monitor what's going on with these vaccines. So there's not a whole bunch of vaccines going on out there that we don't know exactly what's going on with them. They do, and they're mindful, and in real time, they stop and take a look and make sure it's safe. And so there are no bad batches. There's just really good follow-up and prioritizing and making sure that what's out there is good, and that it's still safe and effective. And I think this is really reassuring to me. There's 64 million people worldwide have been vaccinated. Most everybody's prioritizing the elderly and the most vulnerable, frontline healthcare workers, and people that are taking care of the most vulnerable. These are our partners. And when we say this, so right now, you're not able to go into Safeway, Rite Aid directly and say, I want a vaccine. These are partners that Contra Costa County gets the dose and pulls it out and sends appointment links to. So it's many hands, many helping hands getting out there, because we know that Contra Costa clinic services, John Muir, we can't do it alone. So it's really getting out to people who have done mass vaccinations before, flus, other vaccines. And that's the way we're going to be sustainable. And that's the way we're going to build it up, the ability to vaccinate our 1 million residents. It's through partnerships. CAL FIRES has been going into setting up what we call pods, where they set up and they vaccinate certain populations. And so we think we're really excited about that and building these partnerships up. The community-based organizations, again, make sure that you know how to go on. They're providing vaccines the portal. You can go in, make yourself appointments. You can ask questions about how they are prioritizing vaccines. They're going to follow the guidance that we are. So you're not going to find them going and just giving it, oh, let's just give it to the 30-year-olds, because there's oversight from the county. And there was one provider that appeared to maybe be giving vaccine and to a younger group. And so they reached out and they said, hey, what's going on there? Because we're all accountable. And so just making sure there's the checks and balances, making sure everybody has a single-minded, equitable mission for administering vaccines. And here again, on here, we can share this, but it's got live links. So if you're La Clinica, if you're Lifelong, if you're CCHS, those are the links. So make sure your information is up to date so that they know how to find you, and you can find out information about how your healthcare provider is providing vaccines. John Muir, they've got a link up here. So if you're a John Muir Health member, they've got information and get the latest information. So you can go onto their MyChart application and get information. We think it's best to go through your health home first, because they're getting allocations for their prioritized group. And when we do that, then this resource for, let's say, people that don't have insurance or are undocumented, we want everybody to have access. And so it's really, we're trying to be good neighbors, good partners in this effort. Everybody has a part. This is what it looks like when you go onto Sutter Health, right? Call the schedule of vaccination due to high demand, right? This is what it's going to look like, but that's how they're sorting, and they're being a partner. I don't have it for VA. I should have had, so I'll see. I got the information for VA. I'll get that next time. And this is Kaiser. This is the message you'll see on the Kaiser page as well. And they will continually be updating their information. And so to keep yourself, right, go to these sources, and they will give you information as well. And I'm not going to say what I think, but I think we have a very high insured population in Contra Costa County. So most people should be able to go to one of these places and get information about how their health home can vaccinate. And I'll close, but I hope there's lots of questions. I hope there's not too many questions, because I didn't cover. But going back to how important prevention is. And so we need to all have our mindset that we need to keep wearing masks. I still wear masks out in public. And when I'm with my mom at her house, because even though I've been vaccinated, she just had her first vaccine, we're still not exactly sure if we can still be a portal for carrying it. And I'll give you an example. And we'll have more information, but when I was a kid, I had not had chickenpox, but my sister had chickenpox years before, and she went over and babysat for some kids who had chickenpox because it was okay, because she'd already had them. But it turns out about a week later, I got chickenpox, because she was able to still, even though she wasn't able to get chickenpox, she apparently was still able to carry it. And so we're just not sure what it looks like for the COVID vaccine. So we still want you, just in case you're in contact with somebody that gets COVID-19, you might not get it, but we're not exactly sure if you can transmit it. The science isn't there for us, and so we want everybody to continue. Prevention matters. I think we need to have our mindset at least through 2021. We're going to still be wearing masks. We're still going to be washing our hands. If you're having symptoms, we still want you, and you think you might be at risk, you can still get tested. We think it's a very low likelihood that if you've had the disease, but if you get really sick and you think it's COVID and you've been vaccinated, that's good information for us as well. So getting tested is still important as well. And let's see. And stay connected, right? There's push, so Facebook, Instagram, Twitter, and YouTube. Contra Costa Health Services presses out and pushes out some really good links and information about how to stay informed, when there's going to be more information about vaccination sites, and it'll push you to the website if we think there's more information that we need, if there's other shelter-in-place orders, if there's updates on the prioritization and who's going to get it. So I think I dashed through that. I did.
Thank you, Heather. We appreciate that. It was really informative. And we've got some questions going in, but before we start, I'm wondering if you can go back to your early slides, which talks about what the vaccine is. Had the kind of spikies coming off that we're so accustomed to seeing.
That one.
So I heard that it's actually, they give you alien DNA.
Yeah.
But I don't see that anywhere on your slide. So I was wondering if you could tell me more about that, about what it is and what it isn't.
What it is. So it's not alien DNA. It is actually, it's a messenger, right? It's just something that our body knows. All of our bodies have messenger RNA, and that's why it doesn't bother us when it comes in. So it's just a vehicle that carries in the vaccine. And then it's just, and so I was thinking about it, because the next vaccine that comes out, because there's going to be another one, and people are going to be suspicious about why did that one come out quickly too. The next one, and you're going to hear it, it's going to be carried in on the cold virus, right? The adenovirus, my son says, and it's a chimpanzee adenovirus. And so the cold vaccine, or the cold virus, which has been deactivated, which is not a real cold, but it's going to go in on that one. And so that's going to be the little car it rides in on. And it's something that our body's familiar with. It's something that doesn't change our DNA. It's just something that gets in there because it's been deactivated, and it dissolves and it goes away. So it's really just something that our body is familiar with. It doesn't change anything about it. It just rides in, carries that one little spike protein that's been deactivated, so that our body at least has some exposure to it, then knows, okay, this is something new. I think it could be dangerous. Let me build up a defense system against it. And that's what it is. So
it's like, so next time you'll remember the vaccine next time. Hey, this was an unwanted visitor. And next time your body will be like, I'm ready with all my weapons to fight it off.
Exactly right. It's a training manual. It's just the training manual. And I think of it like Mission Impossible, if you've ever seen that. They bring you the message, this is your mission. And then it disintegrates the message, right? The vehicle that carried in the message. So that's what I imagine this is why. It's like that special Mission Impossible messenger. Here's the message. Here's the instructions on what you're supposed to do. And now I'm going to disappear. That's what the messenger RNA does. It gets in there, carries that spike protein in. Our body sees, okay, this is our mission. We need to attack it, build the antibodies, and then it gets out of there. Nothing changes. And like I say, I got the vaccine. My firstborn son got the vaccine. The mother of my grandchild, my mother, right? So we all fell into those priority groups. And so I trust it. And I want you to, I believe, it is something, it's good science, it's good medicine. It's the way forward.
Agree. And I want to highlight what you said, which is mRNA is not new. A lot of folks are sort of asking, why so fast? And so maybe can you speak to kind of that history we've had and the relation to SARS-CoV-1, like how we've learned from that?
So it is old. It's at least 10 years that we've been working with this mRNA, and we've been using it for other treatments. And so really we're sort of just cheating off of old technology. And that's okay. That's what you do. You borrow from what's worked before, what have we done? And so that's what we did. And so I kind of lost, I was going on a tangent here, but that's why this is old science, not too old, but old and established science. Mm-hmm. The same with how we develop vaccines. All of this science is good, and we just mobilized much quicker. There was absolutely a willing cohort worldwide of people that said, I want to be on that vaccine trial. And so they were able to recruit a lot of people that wanted to participate in these trials. So it didn't take a long time. It can take 1 to 5 years to get enough people to participate in a clinical trial. This was really fast forwarded, lots of motivated people. And then honestly, the countries, this warp speed, people did invest and say, listen, if you're doing this, let us pay for, not the research, because we didn't want it to be guided by politics, but we will invest and say, we believe in you, and we will pay for 100 million doses for you to keep in the stockpile. And so honestly, some of the vaccine trials are not going to work, and they're not going to make it through to be a successful vaccine, but countries invested in them. And so that's going to be 50 million doses that are not going to be used, or 100 million doses. So it was okay for them to take this risk. They weren't doing it on their own because they knew that there was money paid for the stockpile. They said, if it works, we're there for you. And so that also helped it, because there was money and security in it for them, not to do fake science, but to be able to really go all in.
Okay. right now we only have two vaccines. We got Pfizer, we've got Moderna. And as we said, we're hoping for more folks to come to the rescue with additional vaccines. But can you speak to the idea of like, I think currently Moderna's, you take the first dose and then on 21 days later, you take the second dose. Moderna is, I think, 28 days. Are you hearing any flexibility around that? How closely does someone need to adhere to that?
So I will tell you, so yes, so that's at least, so you want to do it at least 21 days afterwards, no sooner than 21 days, no sooner than 28 days, because that's the way it was studied. And so we really want to, when we study something, we want to do it to as close as that as possible. And you can't, they've just announced that they say up to 6 weeks after the vaccines, it's still, we think you'll have the equivalent efficacy. It'll be exactly the same, and you'll have that 95% protection. And I'm just going to say here, most likely you can get it much later than that because that's the way vaccines are and the immune response. Most likely it could be later than that as well, but we think that that is what's been studied and we really want to stick to that. This is what we know for sure. And we want to, when we give vaccines, we want to know what we know for sure. So no sooner than 21 days for Pfizer, no sooner than 28 days for Moderna. And then we're going to say no later than 6 weeks afterwards for both of the vaccines, because we think that's what's been studied and we think that's it's going to work best.
Mm-hmm.
The next two vaccines that are coming out that we think, AstraZeneca and Johnson & Johnson, both of those we think are attached to, or I know are attached to more of like the cold virus, the flu virus. We think they're going to be single shots. One of them has been studied in 2 shots. We think they're much more stable. We don't think that they're going to need the deep freeze. They can go in, maybe not your kitchen refrigerator, but a refrigerator. And so they're going to be a little more accessible, easier to get out, because I think that's going to be a big component is how do we get it into your primary care providers, refrigerators, and so that it's easier for everybody to get in, because these max back sites, which are going to be great and accessible, still aren't the most convenient for everybody.
Absolutely.
Mm-hmm.
So you said something important. You said we understand the next sort of team of vaccines coming on the scene are attached to a cold virus.
Yes.
Tell me what that means as compared to what we've talked about with mRNA. Like sort of mRNA is the wrapping, and then in this next phase, they have a different wrapping. Is that what you're telling me?
So a different vehicle, right? So a different vehicle that it rides in on, because you need to, because you never can just put it in because it will break down. If we just injected just straight up deactivated COVID-19, you can't do that, right? It needs something to ride into, like a protective shield that can get it in there. So then that protective shield, it goes away. And so then you've got the exposed virus that's been deactivated that the body can react to. I think that there might be, you might have a little more, just like a flu vaccine, you might have a little more flu-like symptoms, maybe, with the second one, because our body is a little more familiar. It's less, instead of being a Prius riding you in invisibility cloak, might be a little more like a diesel truck going in, right? So it's still a vehicle, but you might react to it a little bit more. But still, the way any vaccines, if you've ever been vaccinated, it's going to be a similar experience for both of them.
So you talked about some side effects, and I think the most common side effect is soreness at the injection site. So do you recommend taking, an NSAID before that, or taking some sort of anti-inflammatory like ahead of time, or is that not recommended?
That is not recommended. You've cheated before this, yeah. So it's not, don't take anything before. Wait till after you've had it, and if you've got pain in the arm, you can, or in the next day, go ahead and take it if you're having these symptoms. We think that it's still likely as potent, but we don't want to blunt in any way. We don't want to diminish any way your body's first reaction to it. We want you pure, right, when you get the vaccine. So we think it's not necessarily better for you to take NSAIDs or anything before the vaccine.
Right.
Okay.
So along the same thing of like AstraZeneca, Johnson & Johnson, Moderna, Pfizer. So we only have 2 options right now, and if you can get it, they're scarce, right? As more options come on the scene, should we be looking at different options for different kinds of people? Is it like dating? You might want to try things out. Is it more like, no, we're on a straight path? How does this work?
So that's a really great question. So I think with allocations, We want, of course, you're going to take what is offered to you, but I think there might be some thought about populations that are more nomadic that would really benefit from a single dose. Some people might not be able to get back for a second dose. So we really think those single shot vaccines might be preferable for our homeless population, for our migrant workers, for people that are traveling, people that might not have an infrastructure to be able to get them back reliably for the second vaccine. But both of them are going to be safe for everybody. So it's not going to be, if you've got this set of medical conditions, you should get this one, and you've got this set of medical conditions, you should get the other one. It's really going to be about making sure that people can get their full dose of their vaccine. So that's how that goes. Does that make sense? Is that clear enough?
It does. Again, I feel like this old phrase really resonates in this situation, which is like dance with the girl who brung you, which is like,
Yes.
if you have an opportunity to get the vaccine and
Absolutely.
you feel comfortable with it, let's not wait for someone prettier. Let's take the one that's here with you now.
That's exactly right. You take the vaccine you can get. You take the appointment you can get.
Right.
Absolutely. And sometimes that's going to mean, you really want the vaccine. You might have to drive a little bit further to get it. But if you can get there that day, do it. Right. And that's what we did. Again, I'll go back to my mom. It was in a town 35 miles away. And she says, why can't we get it here in my town? It's like, Mom, this is the appointment that we could get. And that's what we did. Somebody else with Kaiser, I'll tell you, they lived in Castro Valley, and Kaiser said, we don't have any here, but we can get you one in Vacaville. They drove to Vacaville. They were able to do that, but that's not going to be for everybody. So that's why the county is really working with partners, because we want everybody to be able to go down to Safeway or to their primary care provider. We want everybody to have that access.
So I've got some hard questions we're going to get into, Heather, and you and I have talked in advance.
Yes.
So, okay. So for a while, the county said on 75 plus on their link, which I will also drop in the chat. And then for a brief glimmering moment, it said 65 plus. And then that was taken away. Can you tell us why? And sort of what is the current state? Reiterate what you talked about in your slides, but what's the current state of affairs in Contra Costa County?
Okay. So right now, we are prioritizing 75 years and older. We think they're the most vulnerable. And anybody 65 and older who already has a vaccination appointment or is already in the queue to get one. So I'm just being quite honest. So if you were 65 and older and you happen to be in that one little group that was able to get your appointment already, you're going to get your vaccination. So if there's been a commitment made to you that you can get it, you're going to get it. But then we've looked at it, and this is coming down from the states really looking at it and saying, you know what, we really think it's the older, more vulnerable are the ones that get the sickest and die, and we need to take care of them first. And so it appears they're going to say age before everything else. And so 75 and up, there's going to be and the people that can get those older people and the more vulnerable people sick. So it's still going to be frontline workers and people that are taking care of the vulnerable. And so and it's very uncomfortable, and it's not, so full transparency, we really want just one answer, but CDPH, there's been lots of lobbying groups, and I'm just telling you the truth. Everybody wants their group to get it first, and we're essential workers, and we're working in transportation, or we're in the store and everybody's coming into the stores or the restaurants or the teachers. You're right. You're doing all of those things, but within those groups, we say we will vaccinate all of you if you're 75 and older right now. 60, and when it comes, then it's going to be the 65 and older, then it's going to be the 55 and older. So it's really going to be in the vulnerability groups. There are some people that have some health conditions that may qualify sooner, and they may get them as well. But right now we're not doing a lot of the vulnerability index as much as we're doing the age index. Does that sound about?
I think I saw on the website talked about, how many seniors we have north of 75, and I think it was like 77,000.
Yes, good for you.
I'm sure that you guys have all the data on 65 plus as well. So do you have a sense, or does the county have a sense of how long it will take to vaccinate all those who are 65 plus here in Contra Costa County?
65 plus. So we're hoping that if we've got 15,000 vaccinations coming in per week, right? We would love to get through them by the end of February, right? We'd like to be able to get through our 75s and already be started on our 65s. But you throw in these other outlying issues that might come in because the supply, what if we don't get the supply? Because we're getting it week to week. They didn't give us a big batch. And so it's going to be supply chain issues that are going to be the limiting factor. And until we get other authorizations, I don't think anybody would bet their first child on certainty that the supply chain is entirely intact. So that's why it's patience. I think we most think it's going to be, but we're not 100% certain.
Heather, I'm a second child, so I'm worried my parents might bet their second kid on it.
No, I've got just 2 kids. I'm the fifth. Get out of here. I'm the fifth. I'm done.
So if we're hoping, we've got hopefully get through our folks who are north of 75 by the end of February, and then we've got 65. But then we oftentimes have caregivers who are maybe under 65 and the person needing care is under 65. Can you talk to that piece around looking at those sort of co-occurring conditions that might put people at risk that are not about age?
So I would recommend to you, go ahead and with your health home and even with ours, they ask about some co-occurring conditions. And so what happens is human beings are looking at these like, okay, what are these co-occurring conditions? What are these comorbid conditions is what we look at them. And they look at them one by one. So this is the things that take time, right? They look at it and they're like, oh my goodness, yes. Somebody that's got maybe going in for cancer treatment is going to be severely immunocompromised. Somebody else that's got something. So they look at them on a one by one basis. And so think about 1 million people that might be requesting these that they're looking at. So that's where patients. So there may be special considerations and they will be looked at. But I think I had from another presentation where they asked, can I get it sooner if I have asthma? Probably not right now, unless you're older, right? So I think that's what you need to consider on a case-by-case basis.
So that's why it's still so important to still mask, disinfect, not run out and hang out with 35 people outside your household, right? Because we all have a special condition that we think should be raised up, but there are some people who have particular conditions that make it more at risk for them. And for those 75 plus, the isolation is lethal for them as well. So
exactly.
Yeah,
absolutely. And I think to that point, and as much as we don't want to do that, the most of the cases are occurring in households, with your friends. It's not the stranger in the store that's giving it to you. It's the person you know. So when I go to book club, and I still wear a mask when I go to my mom's, when you go to wherever it is that you go and you talk with lots of people, wear your mask, right? You go on the walk with your friends, even though you're outside, either stay 6 feet apart or wear your mask. And so that's really important.
It's going to be for both. Let's wear your mask and let's stay 6 feet apart.
Exactly. Good for you. Yeah. So don't trust anyone, right? And because it's those people that are asymptomatic.
Right.
Yeah.
So we've got a lot of clients among this group. We've got clients that are some north of 65, some north of 75, and they are older adults. And it's really not feasible for them to go to a vaccination site. And also, I would say, even for those who can get to a vaccination site, standing in line for a period of time, it's really not feasible for them. So what is the county working on to make sure those folks whose caregivers come and go, to get them vaccinated in a way that's easy for them?
So this is a really good question. So I think the first step to that is the people that cannot get out of their homes, we need to make sure that their caregivers are vaccinated. That's the most important thing. So we need to get those caregivers vaccinated so they can't bring it home. This is real talk here.
Question first. So if I'm a caregiver of someone who cannot leave their house, maybe I'm an informal caregiver. I'm not really IHSS. I don't work for a company. I'm an informal caregiver, an unpaid caregiver. Can I still sign up through that county link saying that I care for someone who's 65 plus?
Yes, you can. Absolutely. Go ahead. And there's some levels of validation that they might ask for, right? And so if you can, And again, right, these are humans and they're trying to do the best thing because nobody wants to be the reason somebody else, a homebound person got sick. So we really do want to protect those frontline workers, even if it's an unofficial. So put the information in and maybe there might be some validation follow-up to find out and make sure that, yeah, we really do want you vaccinated as well.
Okay. So the first step is the people who are taking care of them. And then what's the county thinking for that second step for those folks who are at home?
So I will tell you that there are some, and I don't know if I know this answer completely because these things change. So honestly, I'm not as conversant in this, but the Sutter, John Muir, and some of our vaccination sites are becoming more and more efficient. And so it might be you're in and you're out within 30 minutes. So we're working on our efficiency, we're working on our access, we're working on the health homes being able to make sure that your providers can get the vaccines. And so as you go to your primary care provider, that's what we're working on, is getting it out to the places that are easier and more accessible to people that have difficulty getting in and around. Okay.
So is the county considering, because we've got, some people are caregivers, they're giving direct care to somewhat older adults. And there's some people, we're not caregivers, but we're support staff to them. We facilitate support groups. We have activities when there's things that we're doing for them. But those folks aren't 65, but they're around people who are. Would they fall in that same category, or is that going to be later down the line?
That's later down the line. That's later down the line. So people that are facilitating doing that. So those are the people that need to wear their masks. They're the people that need to wash their hands, keep their distance, stay home when they're sick. So they're not going to be prioritized at this time.
Okay. So what about seniors who don't have access to the internet? Because, right now, like the appointments are happening online. You mentioned a phone number. Can you tell us what that is so I can put that in the chat?
Yeah. And so I want to see if I can, let me see if I can go back to our here. Let's see if we can get it because it's on this web page. Eligible residents who have difficulty using the form or have internet access can request an appointment by calling this number. And that's
833-629.
833. Let's see here. Let's see what we got. What happened when I clicked on it? So it's on this. Oh, so it is 1-833-829-2626. And I like this, that you asked a question and I was able to go to the place on the website, right? Because that's really going to be important. So learn this, just learn this website, because this is where the information is going to be updated. It tells you about those health partners. It tells you about the distribution phases. It's actually pretty good. People who are eligible here to get vaccinated.
So just say something you talked about before, which is if I am 65 plus and I signed up with the county to get the vaccine before the sort of methodology was changed, am I still in line?
If they sent you a link, right? So if you got something, if they sent you a link to get vaccinated, even if you didn't sign up, if you've received that link, like the golden ticket, you are still going to be honored. And I think those stopped going out on Friday. So if you hadn't gotten one in, you're not going to get one until that eligibility comes up. And that's going to be, we'll go to the next tier as soon as we get through these 77,000, 75 and olders. But I mean, that could be soon. And so, yes. And if you have any vaccine hesitancy, we haven't discussed this enough, please don't have vaccine hesitancy for your older and vulnerable people. So don't talk anybody out of getting a vaccine, right? So I think we have to ask ourselves, is 64 million people before you enough proof that we think it's safe, right? Something would have, we've had it, it's been out, it's been for more than 6 weeks. I don't think we could keep it a secret if things were going south.
But I told you, Heather, the alien,
there's no alien. It's like that message. It's the Mission Impossible. It's in and it disappears. It really does. It doesn't change anything. Pregnant women, we think that pregnant women are much safer getting a COVID vaccine, and providers are saying that, CDC is saying that. We think there's a much greater risk of getting COVID-19 because vaccines are safe in pregnant women. And again, it's a deactivated coronavirus, little spiky protein.
Right. So I would say also, and I'm joking with you guys because I understand there are folks who do have vaccine hesitancy. And I just want to say my team members, because they're in long-term care facilities, they are getting vaccinated. As soon as I'm able to, I would do the same as well. And I just want to really say that that's a decision I'm making myself, but I think it's a good and sound decision. I have a couple quick questions I want to power through, which is early on, you said 89,054 people have been vaccinated. Is that number of doses or is that number of people who've been vaccinated?
Look at you. I think we think that. So let's go to the resources. Do we have the dashboards? That is the number of doses.
Oh, okay. So really it's about half that number of people who have actually received the vaccine. Or
not half, no, because not everybody's gotten their second dose.
Okay.
So it's a lot. And so that's a little bit of the rolling numbers there, right?
Okay.
Because yeah, so the people in the last 3 weeks have only gotten one dose.
Okay. All right.
Right. Yeah, that's good. You're tough. You're good. I tell you, you're such a great advocate. You guys are so lucky.
Thank you. And you talked about February 7th, and this is where I can pick this up, which is what Heather said is by February 7th that the long-term care facilities will all have received their first dose. So that's related to long-term care. Nearing the end here, we're going to power through, which is, what if we got the site and we're sent to like Rite Aid, but there's never any appointments? Like, why is that? I mean, speak to the general issue of like, people feel like they get the golden ticket when they get the link to go sign up. And what you're saying is the golden ticket is actually after that, when you make an appointment.
No way. So they've been scheduling about a week out. So it's not been too bad. You get the golden ticket and they're allocating them with the number of vaccines that we have. So they've been able to get the 75 and older an appointment within a week. That's what it's been looking at like right now. So it's really a shiny silver, if not golden.
Okay. It's pretty good. So Heather, you and I talked 2 weeks ago and all this was different 2 weeks ago. And then we're talking today and it's still a little bit different. And so I'm wondering, you've already committed to this, but I'm saying to everyone else, meet us back here on February 10th at 2 p.m. And we're going to do this again with updated information. So Heather and I are organized people, but sometimes the world is not. And so we know that we're going to have new information in, 3 weeks from now. And we want to ask y'all to come back and invite your other senior service providing friends to come back. And let's see where we're at then. Let's see how many additional seniors we have vaccinated. Let's hear how many more of our staff have been vaccinated. And then we can talk and answer more of those questions. Does that sound fair, Heather?
That sounds great. And so what I want you to do is, I want these slides, like this is what I think I want you to know, but we want to bring to you the information you really want to know. And just know that I'm going to tell you some things, like I'm going to go back on the prevention. There'll be some things that will reinforce, but make sure that we give you the that's valuable to you. So it can be less presentation, more Q&A, getting you the information out. Okay. And everybody's an ambassador, right?
Absolutely. So everyone, Heather's going to send me this PowerPoint and we're going to share it with you along with this recording that we will send out hopefully tomorrow to everyone that you can then share with your friends and your colleagues. Again, we dropped several links in the chat related to the website that Heather went over, the allocations, the link to sign up with the county to hopefully join the queue. And again, we know in 2 more weeks, we'll have lots more information. So just want to thank everyone for all of their work and for making this time to talk together. I hope it has helped to inspire you and make you feel a little more confident. If you have questions, remember we dropped a phone number that if you do need to reach out to them, please be kind to those folks on the phone.
Be very kind. Yeah. Be very kind.
It's going to be a little bit of wait. So maybe have a lunch with you while you sit there, have TV play in the background. You're not going to get helped on the 3rd ring, but they will get to you and know that we are hearing your concerns. So on behalf of Heather and I want to thank everyone for making the time. Heather, thank you so much for a great presentation. We appreciate it. And we will see you all again on February 10th at 2 p.m. We'll send out another invitation. So thank you so much, Heather. Really appreciate you.
Thank you very much. Take care, everybody.
Bye.
Wear your mask. Wear your mask.
Right. Bye-bye.